As we're here in this dental anesthetic video, if you missed the actual one about doing topical anesthetic, go ahead and check out this little title card that I'll throw up here in the upper right. That's going to lead you to the video about placing topical anesthetics, the different types that we have, and their placement in the mouth. Moving on to the next region, we're going to be going over how to put our actual anesthetic syringe together, the different needle types that we have, and the different concoctions that we could be using. Starting off, we're going to go and look into our actual syringe, and we have a couple parts on this one. This is called an aspirating syringe. That means that when the doctor does the injection, he can go and pull back on this little plunger here and see if he's in a place where we do not want to be and can make an adjustment from there. So we go over here and we look at these different parts. We have a thumb ring over here at the bottom that I can go and slip my thumb through. We have this little finger rest bar with these little wings that help with my placement. Inside this little window that we have here is where our carpule will go, and this barrel that sits around it. And all the way at the end is going to be this needle hub that we have, where we're going to screw whichever type of needle that we're going to be using today. The next thing that we have apart from our anesthetic syringe are the different types of needles that we have. And visually you can see the main difference. One of them's shorter, one of them's longer. One of them's blue, one of them's yellow. And they're used for certain parts of the mouth. So going over those little portions right here, this over here on my left side is what's called a 30 gauge blue short needle, a couple names that they may go by. And over here on my right, I have a 27 gauge long yellow needle, or whatever the doctor may call it at their office. And as you can see, length is the main difference here, but also the size of the needle, one of them being a little bit thicker than this blue one, which is a little bit thinner. The parts of selection for these is what area of the mouth are you going to be working in. Over here on this blue side, this is typically used for the top teeth, or what's called the maxillary arch, and that's going to be useful for doing infiltration shots such as ASAs, MSAs, PSAs, greater palatines, or nasal palatines. This is awesome for being able to do that short little reach, and because of the thinner needle, it's a little bit of a nicer, enjoyable time to have this inserted into your gums and get the anesthesia rolling. But over here on this yellow long needle, this is going to be usually for the bottom teeth, or the mandibular arches. This is typically used as a block injection. Because we have a little bit of a longer reach with this needle, we aim more towards the back of the mouth to do a block injection so it can reach the specific spot to numb the lower teeth. That's why we have the length and the thickness on these needles. So those are the differences between these two types of needles. Top teeth, bottom teeth, no matter what, depending on your type of patient, if they're a child or an adult, if they're tall or short, you can have a slight little variation between these depending on your office or how your doctor does their injections. So let's go ahead and move away from that and go over here to our carpules that we have. The carpule consists of a glass cartridge with a rubber stopper on the bottom, aluminum cap on top, and watch out if it drops because it can crack and be held in by the tape around it, which is going to hold it in place. Our carpules have a couple different things about them. For one, the band colors. Apart from having just pretty colors in general, these are important because these have different types of medicines, different epinephrine values that are important to the procedure we're going to do. And also a short, intermediate, or long-lasting effect on how long the numbing is going to last. The most common one is lidocaine or septicaine, whichever generic or brand name that they have. This is one of the most common local anesthetics used, generally used for like fillings or regular restorations that we're going to be doing in the dental office. When it comes to lidocaine, there's a red and a green. Red is usually used for the fillings and such, but green is really nice because of the extra epinephrine. It helps with controlling bleeding, such as if we have gingivitis or some crown preps that are a little bit too saucy for our procedure. Bupivacaine, also known as Marcaine, is really great for root canals or extractions where we want the anesthetic to last a little bit longer past our normal procedure times or longer procedures in general. Carbocaine is a super important one that we want to use for people that have heart issues. The reason being is because it has no epinephrine in this version of it, and that's important so that the heart doesn't get jump-started by any of our spicy chemicals that help with numbness. There are also very neat things out there, such as reversible anesthetics, where if the injection happens, it's going to reduce the time of numbness that you feel, which for some weirdos that want to feel that soreness or pain, let them have it then, sure. Your hygienist may use Orkix also as an alternative to the full injection, and this will go and give a nice ligamental injection right where the tooth is going to be worked on for like deeper cleanings and such. And then also with the different types of injections, there are also types of vibrational tools to help shake those cheeks for your pleasure of not feeling the injection as much. So when it comes to putting this anesthetic syringe together, what we can do is we can go and take this thumb ring and this little plunger or piston that we have here, and we're just going to go and pull it down. This is going to open up a channel in this window so that I can go and take one of my anesthetic carpules, and with this hub facing towards this needle hub is going to be inserted inside of this barrel. And once I have that in place, I can go and release on my plunger, and that's going to go and lock it out so that this piece doesn't fall out anymore. If you want to engage the aspirating abilities of our actual syringe, what you're going to do is right here inside on this piston is going to be a nice harpoon or an arrow-like look, and you're going to want to push it down so it inserts itself right into that little rubber diaphragm. Now my aspirating syringe is engaged, and the doctor can go and pull back and check if they are near any types of veins. With that, what we can do from there is go and select whatever type of needle that we're going to use. Let's say we're going to be working on the maxillary, and I go and take my blue. A fun thing is on every single one of these little needles, there's going to be a seal of freshness, as we like to call it, where if I go and twist it, I should feel and hear a snap. And with that, now that that seal of freshness has told me this needle has never been used before, I can go and take it apart, and I can go and place this right into my needle hub, and I can go and do righty-tighty to go and lock it onto my actual syringe. And now that that has been tightened down all the way, a nice thing to make sure that you've actually put it together correctly is to express a little of this medication into our actual needle cap here. If I went and just kind of pushed down just a slight bit on this plunger, you're going to see right inside this needle cap, a little bit of our anesthetic is going to gather. That tells me that there's no blockage right here in this lumen or channel where our needle is engaged into our carpule. And that means it's all ready to go over there. You might be putting this together for your doctor while they're in the room, or preemptively putting this together right before you get started. And it's always important to check our equipment before we actually hand it off to doc so that it's a smooth transition into the procedure. From there, let's say that if doc was to go and use the needle, anesthetize, and left this beautiful little needle syringe all put together but with no cap on the tray, and they just left it there. Well, that's not going to fly. We're going to need to go and recap this, and we have a couple ways of doing this, but the one thing you always remember is that you should never use two hands to recap this. The main thing is you never want to put these needles back together hand in hand. It should always be a one-handed type of cap reinsertion, because this is just asking for a needle stick, especially if you were to go and play around here and your depth perception is not the best. You're going to go and give yourself a stick after this has been in someone asking for a disease to be transferred to you. So always remember that we're going to try and do everything in the safest way as possible so that we don't get infected or contract anything from our patients. So with this needle cap on our tray, so what we're going to do here is a single hand swoop recap method. That's where you just go and pick it up, pick up the lid just as so, pull this into place instead of push it, because the possibility of this slipping and breaking might cause an issue where it'll stick me. So I'm going to go and re-secure it by pulling down. Other great ways of recapping your needles safely is using these little tools that we have here. There are going to be some cute things such as these little cardboard pads that you go have this protective needle cap inserted into, and it just kind of sticks right there at an angle. So we have it there so we can just go and stick our landing and be protected. So that's a nice little way. The other one that they have are these little needle cap holders that have that same type of action. But if you find that your office doesn't have any of these little fancy things, as simple as just having our basic setup there, as we always do, we can go and just pre-insert this right into the jaws of our cotton pliers, and we can just go and plant that in place, and we're good to go from there. Always make sure to pre-cap this in a safe manner. Apart from that, if this is the first time and you're learning something today, awesome, leave a like. Stick around for my channel to see about more dental things if you're interested. We'll see you next time.